this video we will talk about nephron. Nephrons are the working units of kidneys. Each nephron is a tiny filter and purifier. Each kidney has about 1 million nephrons. These are found in renal cortex and extend into the medulla region. As you can see in this figure, the nephron is present in the cortex region, which is extending down towards the renal medulla region. What does nephron do? Blood with unwanted products of various physiological processes or body organs come to the kidney and undergo filtration. Nephron is the most basic unit of filtration process. Tiny blood vessels called capillaries carry blood to each nephron, where wastes are filtered out and needed substances and water is reabsorbed. A nephron is made up of a glomerulus and a tubule. Let us now discuss parts of nephron. Nephron consists of renal corpuscle and renal tubule. Let us now discuss renal corpuscle. Renal corpuscle is a part where the blood plasma is filtered. The two parts of renal corpuscle are glomerulus and Bowman's capsule. This part is known as glomerulus and the structure surrounding it is known as Bowman's capsule. Glomerulus. It is a tangled ball of capillaries. It is held together by a membrane as discussed previously known as Bowman's capsule. In this image you can see the Bowman's capsule which is surrounding the glomerulus. Let us now discuss the flow of fluid through renal corpuscle. Blood enters each glomerulus from an afferent arteriole which is a small artery. This is known as the afferent arteriole. Blood plasma is then filtered through the glomerular capsule. As you see here, the blood enters through the afferent arteriole into the glomerulus and then it is filtered through the Bowman's capsule and moved towards the renal tubule. The capillaries walls are semi-permeable, that is, they have pores that let small substances pass through, but does not allow blood cells and large particles like proteins to pass. Small waste pass through the pores along with the water to form a liquid called the glomerular filtrate. If nephrons are damaged, it allows the larger substances like protein to pass. A normal adult makes about 125 milliliters of glomerular filtration per minute, that is about 180 liters per day. The second part of nephron is known as the renal tubules. Renal tubule is the part into which the filtered fluid or glomerular filtrate passes. The filtrate passes through this section which is known as the renal tubule. Let us now see the parts of renal tubule. The first portion is known as the proximal convoluted tubule. This portion is known as proximal convoluted tubule which is present near to the renal corpuscle. Next to proximal convoluted tubule is loop of Henle, followed by the DCT or distal convoluted tubule, which finally drains into the collecting tubule. This picture shows the process of urine formation. As you see here, the blood enters into the glomerulus, filtered by the Bowman's capsule, received into the proximal tubule where certain substances are reabsorbed. R represents the reabsorption process, S is the secretion. Certain substances which are not required are secreted into the PCT or proximal tubule and certain substances which are required are reabsorbed into the blood. Further, the filtrate passes through the loop of Henle. Here, certain substances are reabsorbed back into the blood. Again, in DCT or distal tubule, there are certain substances which are reabsorbed and certain substances are secreted. The same process follows through the collecting tubules. Certain substances are secreted and reabsorbed. The final product, that is urine, passes on towards the bladder to be released out of the body. Many chemicals and water are reabsorbed in the body through the tubule and sent back to the blood. The other components are transferred to minor calyx and finally moving on to major calyx, which then flows into the ureter to be excreted as urine. Let us now discuss the types of nephron. Nephrons are classified according to their location with respect to the renal corpuscle. The first type is the cortical nephron. The cortical nephron have their renal corpuscle in the superficial renal cortex. As you can see in this image, the renal corpuscle of the cortical nephron is located in the renal cortex region. Cortical nephrons, which are about 85% of all nephrons, mainly perform excretory and regulatory functions. The second type of nephrons are juxtamedullary nephrons. The renal corpuscle of juxtamedullary nephrons are located near the renal medulla. Here is an example of juxtamedullary nephron whose renal corpuscle is located near the renal medulla region. Juxtamedullary nephrons, that is about 15% of them, concentrate and dilute urine. In the next video, we will talk about functions of